All right, breaking inputs coming in. COVID cases continue to surge in Kerala. The state has reported 32,097 new COVID cases and 188 deaths in the last 24 hours. The positivity rate is 18.41%. Thrissur district reported a highest surge of 4,334 cases, followed by Ernakulam with 3,768 cases in the last 24 hours. The current active cases tally stands at 2.40 lakhs. And we continue tracking the COVID surge across Kerala, and that has also taken up India's tally. Now, India recorded over 47,000 new COVID cases in the last 24 hours. This is the highest daily COVID cases tally in the last 2 months. Out of these, Kerala alone reported over 32,000 new COVID cases. The centre has said that in the last 7 days, 69% of COVID cases have been reported from Kerala. Ahead of the festive season, centre cautioned that mass gatherings must be discouraged. The Health Ministry also said that festivals must be celebrated just like last year. The Health Ministry further said that though the daily number of new COVID cases has been falling since the peak in May, the second wave is not over yet.
Our precautions must continue and get intensified. मास्क उतारने का, मास्क के बिना जीने का भी कोई मौका नहीं आया है। त्योहारों को इस साल जैसे पिछले साल हमने अलग तरीके से ही मनाना है। जो त्योहार आएंगे हम परिवार में ही बैठ के मनाएंगे, हम भीड़ से नहीं मनाएंगे।
All right, for more on this, I'm joined by my colleague Ayushman on the broadcast. Ayushman, what we continue to see is a surge in COVID cases in Kerala. Centre, they're warning the people that ahead of the festive season, they have to be cautious and they should be celebrating their festivals as last year. What more details can you share as far as Centre's review of COVID situation is concerned? Especially, they also got in touch with the health ministers of Karnataka and Tamil Nadu last evening.
Yes, in fact, Archana, if there is one scare right now, which is on the broader picture that the Health Ministry is identifying, is the scare of festivities. And in fact, it has been written and has been said by the ICMR that festivities and the large crowding can be a super spreader event. If at all, the gathering has to be there. It has to be ensured that everybody in that gathering should be completely vaccinated, is what the ICMR DG today said. The festival are approaching, and that is why it has been said that somewhere the way we celebrated this festival last year in isolation and in our houses is something that should be repeated again this year because the situation has not yet normalized. On February 9, we saw 9,000 cases of COVID, and that was the lowest since first wave. And after that, the cases started peaking up. In the ebbing condition of the second wave, we are yet to see that number. Numbers have not gone down till 10,000 yet. It is still hovering between 50,000 to 40,000. Kerala contributing a significant chunk of that. So the current tension is of the rising number and the festivals which are approaching and the large gathering which may take place if the stricter norms are not there in place. But apart from that, there was also one important point which the member Health Niti Ayog said, and that was of the vaccination, in which he said that pregnant women possibly are not coming in larger number to which it was expected, and that is why it is expected that they should come out in large number and get themselves vaccinated. Also, people are also there who have not taken their second dose despite the time interval getting ended. And that's why he has again said that people need to take 2 doses of COVID-19 vaccine so that they can attain full immunity, though vaccines don't decrease the chance of you contracting the disease. They definitely curtail the chance of severe disease. So far, the current tension remains is of the festivities and the large gathering, and that has been focused upon here. Archana.
All right, thank you, Ayushman, for bringing us up to speed with that word of caution that the centre has issued ahead of the festive season, asking people to celebrate their festivals just like last year.